MediGroup Physician Services presents MediGroup's Frank's Fast Five with Healthcare Executives, produced by Bridget Wilson and Carrie Peters. Today's guest is Jim Cuniff, President and CEO for Provista. Now, here's your host, MediGroup's Frank Gillespie.
Hello, everyone, and welcome to another edition of MediGroup's Frank's Fast Five with Healthcare Executives. And alongside me today, too, is MediGroup's CEO, Andy Klearman. Hey, Andy.
Hey, Frank. Great to be here with you today.
I'm honored that you're here with me. This is fun and it's great. And even more fun is the fact that today, Andy and I are here with Jim Cuniff, President and CEO for Provista. Jim, welcome.
Hey, thank you. It's great to be here as well. I'm looking forward to this chat we're going to have.
Yes, sir. Thank you so much. We appreciate and respect your time. So, Jim, I promised you we wouldn't waste your time, and we're going to jump right into it. Question number one. Jim, how long have you been in your role as President and CEO for Provista? And as President and CEO, could you give us a brief idea of what your vision is for Provista?
Yeah, I'd love to. I've actually been with Provista for a little over 4 years. And I've been in the healthcare industry for over 30 years. So I've got quite a bit of experience. A lot of my time has been spent with medical device companies, both here domestically in the United States as well as internationally. But as it relates to Provista, really my vision is for our members to view us as their trusted partner to help them solve their cost, quality, and market performance challenges. And as both of you know, these challenges have only been amplified in the past year due to the pandemic. And the good news is that Provista is uniquely positioned to help our members in 4 areas. The first of which is our extensive contract portfolio, which helps our members save money on the products and services which they buy at no cost to them. We have over $100 billion in spend running through our contracts. And this has only been enhanced through our Inhaler acquisition we made earlier this year. And what I'm expecting is that will further expand our membership and offerings. The second area that we help our members is our analytics capabilities, where we can identify savings opportunities for our members on products they are buying, as well as suggest product substitutions which may offer better quality or savings. And that savings piece, really, especially as it relates to COVID, is really important. The third area I would say, gentlemen, is our procurement solutions, which allow our members to offload some or all of their procurement functions to us so that they can focus on what they do best, which is patient care versus purchasing. And I guess the fourth area would be collaboration services, where we get like-minded members together to discuss and tackle issues and opportunities they may have where Provista can provide support. So those are really the 4 areas that we do to help address cost, quality, and market performance.
Well, thanks, Jim. Andy here. Last year certainly was a challenge for everybody with the pandemic. Could you tell us a little bit about how that affected Provista, and are you still addressing things differently than usual this year? And lastly, do you see any new normals for Provista?
Yeah, so good questions, Andy, and good to see you. Yeah, I guess in answer to your first question, yes, we were certainly impacted by COVID. Most of the non-acute physician visits and elective surgeries during the months of March and April of last year were put on hold. And as you can imagine, most of our business and hospitality members were severely impacted as hotels, casinos, and restaurants reduced their capacity or closed. And as a business, to mitigate our revenue challenges, we had to curtail our T&E expenses. But the upshot of that is, fortunately, we did not have to furlough or lay off any employees. In fact, we hired employees last year. And all that being said, starting in May of 2020, our business began to rebound as elective surgeries moved from the inpatient to the outpatient setting. Also, many of our members began to outsource their procurement to us, which is where we've seen really exponential growth. And in fact, just to put things in perspective, we bought a company 3 years ago that does procurement services. We bought them, they had 118 systems that were on their platform. We have over 2,000 today, so it's really grown quite quickly. I guess relative to your second question, a couple of areas we are addressing differently because of the pandemic. And a lot of it's internally, but we do believe these will persist. And number one is I think the toothpaste is out of the tube on employees working remotely and having flex office schedules. And that's something that we're working through right now, quite candidly. And number two, we need to meet our members where they are, both in terms of how we show up to support our members and in the frequency of live interactions, because a lot of our members have gotten used, like we're doing today on this Zoom call. They've been used to working with us remotely. And so a lot of the travel our team has been doing to meet with our members, I think that's going to become, especially live interactions, more the exception than the rule.
Great, thank you.
You're welcome.
Appreciate it, Jim. And Jim, for question number 3, can you tell us if Provista Vizient plans to have a national meeting this year? And if so, will it be virtual or in person?
We're going to have a member meeting at the end of this year, but having a national meeting, we are definitely planning on having national meetings next year, and they will be live. The meeting that we're going to be having in the fall, which is a fall summit with our members, that will be live as well. So very good news on both fronts.
That's great news for people and folks. It's nice to see things opening back up for sure. So that's great news for us. Thank you. Question number 4, Jim, how does Provista and Vizient intersect in the healthcare marketplace?
Yeah, that's a great question and one I get quite often. Just to put things in context, Provista is a Vizient company, and essentially whereas Vizient is focused on the acute care market, Provista's focus is on the non-acute market. And for example, that would be entities like ambulatory surgery centers, urgent care facilities, physician offices, long-term care, et cetera. In short, Provista is an extension of Vizient on the non-acute market, both in terms of contract portfolios. So we extend all of Vizient's contracts into the non-acute market and the services we provide. And we're really a little bit more selective on those services because not all of the services Vizient supplies to the acute care members are applicable to the non-acute members. But when they are, we do extend them to our classes of trade.
I think that clarification is extremely valuable as people learn about the different organizations and the complexities of a large organization, but how they all intersect together. And that makes a lot of difference. Thank you for that clarification.
Pleasure.
And lastly, I can't believe we're to question 5 already, but lastly, we know one of your vice presidents, Micah Smith's favorite hobby is mountain biking. Jim, could you share with us one of your hobbies or favorite things to do?
I'm kind of laughing about that, Micah's favorite hobby, because I think right now, current state is Micah's now retired from mountain biking. You may or may not know this. He was avidly riding and suffered a serious knee injury last year. So I think he's
did not know that.
Retired from that.
No,
but I did want to let you know, I too am an avid cyclist and have been doing quite a bit of it in the last 12 months. And another favorite thing that I'd like to do is travel. I've got great wanderlust. I've been to every continent with the exception of Antarctica. By the way, that's not on the bucket list. I like to travel, and it's great. Now that COVID is becoming, we're getting used to living with COVID, and travel has been opening up. That's been really liberating.
Absolutely. Well, thank you for a fascinating, informative, and great interview. Again, we highly respect your time. This was my first time actually to get to meet you in person. So it's an honor and a pleasure, and we thank you. And Andy, any final words from you?
Jim, just great to see you, and thank you very much.
Likewise. And Frank, nice to meet you. And Andy, great to see you as always. And thanks for this opportunity. This was a lot of fun.
Thank you so much. We really appreciate it. Take care, Jim. We'll talk to you again soon.
This has been MediGroup's Frank's Fast 5 with healthcare executives, produced by Bridget Wilson and Carrie Peters, and hosted by Frank Gillespie. Special thanks to Jim Cuniff, President and CEO for Provista. This has been a presentation of MediGroup Physician Services.